Hey everybody, I'm William Knight. I'm a family medicine doctor at SouthCoast Health, and today we're going to talk about men's health. So men's health is a topic that not a lot of people want to talk about, and a lot of guys think they don't necessarily need a doctor. But there's a lot of health issues that kind of creep up on you, and maybe you don't catch on or know about them unless you're seeing a doctor regularly. So today I've got my dad here with me, Bill, and we're going to talk about the things that you go through at the different decades, because by now you've been through the decades and pretty much all the screening things we check for every year.
Yep.
So for example, when you come in for your annual physical, so we're looking at blood pressure, height, weight, BMI, which can tell you risk factors for other problems such as heart disease. So we'll do screening for cholesterol, we check liver, electrolyte and kidney functions, we check blood count, screening for anemia. If you're smoking, we work on quitting smoking. We also try to make sure that your vaccinations are up to date. So starting as early as your 20s, we're looking at making sure you're eating right, make sure you're staying active. Exercise is still important. Also, sexual health is important at that age. Screening for sexually transmitted diseases is always important. In your 30s, we're again starting to look at risk for heart disease. That's when we start screening for cholesterol. Once you reach 40, we're looking at cholesterol a little bit closer, as well as screening for blood pressure. Blood pressure problems tend to arise in people's 40s. So high blood pressure is an important thing that all men should keep an eye out for. And the reason is that high blood pressure is known as the silent killer. People with high blood pressure are at risk for heart attacks, they're at risk for strokes. At 50 is when it's important to get a colonoscopy, because we're looking for colon cancer screening, but nobody likes colon cancer screening because nobody likes the idea of a colonoscopy.
Nobody. The first year when it was in my 50s and my doctor recommended it, and I argued with him a little bit, I said okay, and I went to make an appointment, and I found out the person he recommended was not in network, so that was a good reason for me not to do it. But finally the next year I did, and it wasn't as bad as I thought. Once you do it, and you don't have to do it very often. And
another major thing at age 50 is the shingles vaccine. So shingles is a terrible disease that anyone who had chickenpox when they were a child is at risk for. So I usually recommend the shingles vaccine for pretty much everybody. Once you turn 65, we do everything that you were doing through your 50s, but we also have the pneumonia vaccines. You're due for a booster at that point. It's actually now 2 boosters, one at age 65 and another one at age 66. And this is simply important because it reduces your risk of pneumonia after age 65. So this may sound crazy, but I'm actually not a fan of medication. There are a lot of problems that I deal with on a daily basis: diabetes, high blood pressure, high cholesterol, obesity. All of these things can be fixed through changes in your lifestyle.
if you're a man and you're reluctant to see your doctor, you need to remember that there's things your doctor might catch that could save your life. And you need to realize that your doctor is your friend.